I'm Dr. Upasana Jarori. I'm a cardiologist with IU Health. I've been practicing since 2013. So my decision to become a doctor goes back to when I was a young Boilermaker pursuing my education in biomedical engineering. Back then I got really mesmerized by the heart. I found it to be a really fascinating organ system in the body. It had the amazing ability to adapt rapidly with the complex feedback mechanisms, complex electrical networking, and that's really what captured my attention. Back then I thought I would contribute to the field as a biomedical engineer developing new design and technology. But I soon realized that what truly fueled my passion for medicine was the patient interaction, my ability to build those relationships with the patients that I saw and the people that I was going to help. And that's what really helped guide me to the field of medicine. When you come to see me for the first time, I'd like to get to know you and not just your medical condition. I will take the time to sit down with you and explain to you what each step of the process is and how we're going to go through it. And for me, the most important thing is that we do is shared decision making, which is we go through this process together. I want to understand what are your biggest concerns, and I would like to know what it is that you want to accomplish with that visit. There are a number of different treatment plans that can be pursued, but what works for one person may not work for the other. Which is why it's really important to me that we talk through the process and we figure out what is right for you together. Coming to see a specialist like me is not easy. It's always a difficult journey that's brought you to me. And so one of the most important things for me is building a relationship of trust between us. My relationship with my patients is by far the most important part of my job and what I love the most. Outside of that, though, I love the versatility that this job offers. I get to see patients in the clinic, I get to round on them in the hospital, I get to read echocardiograms and stress tests, I get to participate in research activities, and my favorite part, I get to be a part of educating the doctors of the next generation. This job offers me an opportunity to be a physician, an educator, and a researcher, and I'm really grateful for that. When I'm not caring for patients, I love spending time with my friends and family, especially my two little nephews. Outside of that, I love cooking ethnic food and I love trying out new restaurants around town.